In 21 years, the PPPC administration has increased healthcare services and delivery in Guyana. Today, every Guyanese have access not only to primary health care, but to a large extent specialized healthcare services as well. Apart from allocating increasing amount of resources to the health sector, government has also been partnering with international and other organizations to improve the capacities of health institutions so as to improve the level and quality of healthcare services offered to Guyanese. To this end, the New Amsterdam and Linden Hospital Complex have recently welcomed the establishment of neonatal intensive care services as a result of a partnership with Guyana Help the Kids.
The opening of the NICU here is really a milestone, I believe, in neonatal care in Guyana. But it's truly just a small piece of a bigger picture and a bigger vision by our organization as well as the government of Guyana, headed by the Ministry of Health through Dr. Berry Ramsaran. We intend to expand the neonatal program not only to Georgetown Hospital, but to Linden, to New Amsterdam, to West Demerara, and next year we'd be opening a neonatal ICU at the Suddy Hospital. When I came back about 3 or 4 years ago, I did a little bit of research into pediatric and neonatal care in Guyana, and I found a few things. There are about 15,000 deliveries that occur throughout the country, of which 90% of those deliveries occur between the Georgetown Hospital, Linden, New Amsterdam, West Demerara, as well as Suddy. So if we truly wanted to improve neonatal care, it is important that we focus our attention on those hospitals. So to this end, what we've done to date so far is in March of last year, we opened up a state-of-the-art 24-bed neonatal intensive care unit at the Georgetown Hospital. And this is not just Guyana Help the Kids. This is a true partnership between our organization, the minister, the University of Guyana, as well as the Georgetown Public Hospital. I'm proud to say that after 1 year of functioning, we dropped the neonatal mortality rate in half at the Georgetown Hospital.
Guyana Help the Kids is a registered Canadian charity with the goal of decreasing the neonatal and infant mortality in developing countries, particularly in Guyana. It aims to achieve this goal through sustainable changes within the healthcare sector. This unit was much needed at the New Amsterdam Hospital, which recorded a few unfortunate cases of maternal deaths in recent years.
This is a very important step that we are taking here again this morning in the development of the health sector in Berbice. As you know, over the years, we have made very significant inputs into the health system, and we have been offering more and more services incrementally over the years. And so the health system is better geared to serve the needs of the people of this region once we continue to add more and more services to the existing ones that we have. This is a tremendous need in this region.
There has been the need for quite some time now. We've been transferring babies. Some of them, I'm sure, that could have been saved were not saved. And I'm really glad that Dr. Nair had decided that he's going to come and help us here. And like Dr. Yakub said, he's not only provided the $1 million equipment that we needed, but he's also providing training, and as far as I understand, once our deal remains the same, he's going to continue providing training for our nurses, for our doctors, so that we could get maximum out of the equipment, out of the area and the training that we would have had. So the patients, the babies, the parents will reap the benefits. We have been, I'm sure that there are a lot of people who felt that New Amsterdam Hospital could not have accomplished what we have accomplished because we had to meet certain standards before the equipment was shipped here. But we have done it, and I want to say thanks to everybody, in particular Dr. Sharma, Mr. Johnson, and the REO.
Minister of Health Dr. Berry Ramsaran spoke of all the significant investments that the government of Guyana has been making in the social sector, particularly as it relates to health. This year, The national budget has provided $19.2 billion for the health sector, the largest allocation to date.
We hope that by introducing this service, we'll be able to reduce deaths among neonates. This is especially among those who would have been born underweight, premature, or with, to use the common language, birth defects. And we have already started to achieve it. Initial data from Georgetown Hospital shows a significant reduction in this group of patients. With that in mind, the Ministry of Health has grasped eagerly at the opportunity to work with Dr. Narsingh and his support organizations, to which he referred earlier, in achieving or in establishing these units.
Over the past few years, the number of graduate doctors deployed to the hospital has increased with the addition of several Cuban-trained medical practitioners and the continuous professional upgrade of nursing and medical staff.
The graduate doctors who are now coming back, not in their tens, not in their dozens, not in their scores, but in their hundreds. I want to refer to that so that you will follow what the administration has been trying to do.
Meanwhile, the neonatal unit in Linden will see fewer patients from Region 10 traveling to Georgetown to access these services. Various pieces of equipment such as monitors and incubators have also been donated to the neonatology intensive care unit at the Linden Hospital.
If, for example, the baby needs to be transferred down, there'll be a network of transport. So, for example, this particular piece of equipment here is a transport incubator. So if a baby needs to be transferred, for example, from Linden to Georgetown, they go in something like this. It has wheels, it's warm, it has a monitor. So it gives the baby the best possible chance of survival.
Only recently, 2 doctors from Ohio visited Guyana to train 25 nurses at the Linden Hospital complex using the said equipment.
Our plan really is to expand the neonatal program throughout the country, because we feel that if we were to do that, we could make a significant impact on the neonatal mortality in the country, which is relatively high at the moment.
In March, the refurbished GPHC's neonatal intensive care unit was opened following a collaborative effort with Guyana Help the Kids. The organization has also donated a quantity of equipment to the hospital. In the first year of the partnership between Guyana Help the Kids and the Health Ministry, neonatal mortality at the GPHC decreased by 40%. The program will be further expanded to other regional hospitals in Guyana in the near future.